Michael Cannon is back with us. He's the Director of Health Policy Studies at the Cato Institute. And Michael, none of this stuff makes sense and none of this stuff makes sense. Here we are. We're worried about. We've been worried for years, since 1980, that Medicaid and Medicare, it's going to go bankrupt by 2017, 2018. We're not going to be able to afford it. And now we're talking about massive spending on top of it, just expanding it, basically. And now we're getting giant corporations getting into bed with our government. Once you strip, once you build a private-public partnership with these corporations, it all changes, doesn't it?
Well, it's not just corporations. It's all sorts of special interest groups. All the activity we've seen with the Obama administration reaching out to the healthcare industry and everyone coming to the table and everyone saying we want reform. The industry is participating because they expect to make more money off of healthcare reform. That's what's happened in Massachusetts, for example.
I was just going to say, did you see what happened in Massachusetts with the Rasmussen report? Where
absolutely, what happened?
Go ahead.
Go ahead.
No.
Well, what happened in Massachusetts was the doctors, the hospitals, the insurance companies, they got together with the government and said, how can we pump more money into Massachusetts healthcare sector without doing anything to fix the inefficiencies, the enormous inefficiencies in Massachusetts healthcare sector? So what they did is they taxed Massachusetts residents. Well, first of all, they sent half the cost to the rest of us, to the federal government. But then they taxed Massachusetts residents a little bit directly. They taxed them a little bit by putting hidden taxes in their insurance premiums. And they taxed them a little bit more by reducing their wages. So they hit all these taxes so that Massachusetts residents wouldn't notice just how much they were being screwed. And what happened? Well, a recent poll said that 26% of Massachusetts residents think that this was a success. So it looks like the people aren't as easy to fool as the special interests in the government would like.
But you know what's interesting is the poorest thought that it was making their health care harder to get, less affordable. The poorest didn't like it, said the quality has gone down, and it was harder for them or more expensive for them to access. Of course, because they were getting it for free at the hospital. Everyone else all across the board said it's making it worse, especially those with kids, making it worse. More expensive. I mean, we're already talking about rationing care up in Massachusetts, are we not?
They are talking about rationing care. In fact, the cost of this reform, having pumped all this money into Massachusetts healthcare sector, the cost of these reforms has been so great that they're now looking at steps to ration care, much like the tools they use in Canada. They want to give doctors in hospitals the incentive to ration care. So Massachusetts is actually moving closer to Canada by the day, and that's exactly what's going to happen with President Obama's reforms if he gets them enacted at a national level.
I think these progressives in the White House and in Congress are absolutely brilliant. They learned from Clinton care, Hillary care. They had studies, they had, blue ribbon panels and everything else. They don't really even care about the structure. They just want it in. Just give me the framework. We'll work out all the details later. And people aren't even seeing it coming. If I meet one more person on the street that says, cap and trade, what is that? What are you guys talking about? Here it comes, gang. Here it comes. Michael, thank you very much.